Hello everyone. Welcome to the Anatomy channel, where we provide and explain medical knowledge in the simplest way for everyone to understand. You've probably heard of high blood pressure and may wonder why it's such a big deal. Why is high blood pressure so dangerous that you need to take medication and monitor it every day, even when you still feel healthy? We will explore this topic in today's video. First, what is blood pressure? Imagine our heart as a pump, and the blood vessels as water pipes. Blood contains red blood cells that carry oxygen and nutrients to nourish the organs throughout the body. Blood pressure is the force that this pump generates when pushing blood to organs like the brain, liver, kidneys, intestines, muscles, and even to the heart itself. On the blood pressure monitor, it is displayed as two numbers. The top number, also called systolic pressure, is the force when the heart contracts to pump blood. The bottom number, called diastolic pressure, is the force when the heart relaxes between beats. For a normal person, systolic blood pressure can range from 90 to 135 millimeters of mercury, and diastolic pressure ranges from 60 to 85 millimeters of mercury. People often read blood pressure as 120/80, or 12/8. The lowest number shown on the monitor is the heart rate, which represents the number of beats per minute, ideally between 60 to 80 beats when resting. So, how dangerous is high blood pressure? When blood pressure stays elevated for a long time, you may not feel any symptoms, but inside your body, the blood vessels are under significant pressure and become damaged. Over time, the walls of the blood vessels thicken and stiffen to adapt to the increased pressure, narrowing the blood vessel's diameter. The issue worsens if you also have high cholesterol or lipid disorders. Fat can accumulate on the vessel walls, like debris in water pipes, forming atherosclerotic plaques. This will further clog the vessels and reduce blood flow to vital organs. One day, for some reason, like stress, anger, or overwork, if your systolic blood pressure suddenly spikes above 180 millimeters of mercury, or your diastolic pressure above 110 millimeters of mercury, your heart could become overloaded. In severe cases, this leads to acute heart failure, causing fatigue and shortness of breath. Under high pressure, atherosclerotic plaques can dislodge, and a blood clot may form, blocking an artery that feeds the heart. This can lead to a heart attack, with symptoms such as severe chest pain, a crushing sensation in the chest, and pain radiating down the left or right arm or up to the jaw. You may also experience shortness of breath, sweating, anxiety, and fainting. If you have sudden chest pain while at rest that lasts more than 10 minutes, along with these symptoms, head to the hospital as soon as possible. And what happened to the brain? The blood vessels in the brain can also become blocked or burst due to high blood pressure, leading to a stroke, with symptoms like severe headaches, dizziness, loss of balance, blurred vision, facial drooping, weakness in the arms or legs, or difficulty speaking. If you notice these signs, check your blood pressure and go to the hospital immediately. In addition to acute incidents, prolonged high blood pressure forces the heart to work harder, thickening the heart muscle, eventually leading to heart enlargement and chronic heart failure. Blood vessels in the kidneys also narrow, leading to kidney failure. The retina in the eyes may bleed, causing a decrease in vision. Some people say, "My blood pressure is only mildly high, is it okay?" A large study in China that followed nearly 100,000 people in 10 years showed that blood pressure between 130/80 and 139/89 millimeters of mercury increased the risk of stroke and heart attack by 35%, compared to those with blood pressure under 120/80 millimeters of mercury. And for blood pressure of 140/90 millimeters of mercury or higher, the risk increased by up to 165%. So, even mild increases in blood pressure raise cardiovascular risks. That's why it's essential to regularly check your blood pressure and not be complacent. So, what causes high blood pressure? There are two main types of hypertensions. Primary hypertension, this is the most common type and has no clear cause. It usually appears as we age. If you are overweight, sedentary, eat a lot of salty foods, consume little fiber and fruits, or experience prolonged stress and lack of sleep, you are at a higher risk of developing this type in the future, especially if your family has a history of hypertension. Secondary hypertension, this type has a specific cause, such as kidney disease, adrenal or thyroid problems, pregnancy-induced hypertension, or taking certain medications such as oral nonsteroidal anti-inflammatory drugs and corticosteroids. It is often associated with higher and more dangerous blood pressure levels but can be completely cured once the cause is identified. Next, how can hypertension be diagnosed? As mentioned, some people with high blood pressure may experience headaches or dizziness, but most have no symptoms. The only way to know for sure is to measure your blood pressure regularly. According to the International Society of Hypertension in 2020, a diagnosis of hypertension is made if your home blood pressure measurement during the day is 135/85 millimeters of mercury or higher, or if your clinic measurement is 140/90 millimeters of mercury or higher. Repeat it at least twice before taking your blood pressure. Avoid smoking, coffee, or exercise for at least 30 minutes. I'll cover more details on how to measure blood pressure in another video. But how can we maintain a healthy blood pressure level? We must lower blood pressure and keep it at a safe level by adopting healthy lifestyle habits and taking prescribed blood pressure medications every day. A good lifestyle includes healthy nutrition, physical activity, healthy daily routines, and good mental health. According to a large meta-analysis, a low-salt diet, reducing saturated fats, and increasing intake of vegetables, whole grains, or following the DASH diet can lower systolic blood pressure by about 3 millimeters of mercury. Regular daily exercise and maintaining a healthy weight can reduce systolic blood pressure by up to 8 millimeters of mercury. According to the International Society of Hypertension, avoid smoking and limit alcohol consumption. Also, try to manage stress through activities like meditation, yoga, listening to music, playing sports, or other healthy hobbies. Everyone, no matter their health condition, should maintain such a healthy lifestyle. If lifestyle changes aren't enough to lower blood pressure, your doctor will prescribe medication. It's essential to take your medicine every day and follow up regularly so your doctor can monitor and adjust your treatment as needed. Remember, keeping your blood pressure at a safe level reduces the risk of stroke, heart attack, heart failure, kidney failure, and other health issues in the long run. Regular blood pressure checks, following your doctor's advice, and maintaining a healthy lifestyle are the keys to good cardiovascular health. In summary, hypertension is a condition of elevated pressure in the blood vessels, with systolic pressure from 140 millimeters of mercury and diastolic pressure from 90 millimeters of mercury or higher when measured at the clinic. Acute hypertension can cause heart attacks or strokes, with symptoms like sudden difficulty breathing, severe chest pain, dizziness, loss of balance, fainting, slurred speech, facial drooping eyelids, blurred vision, numbness, or weakness in the limbs. Go to the hospital immediately if you experience these symptoms. Chronic hypertension can lead to blockages in the blood vessels that supply the heart, brain, kidneys, and eyes, gradually resulting in heart failure, kidney failure, vision loss, or cognitive decline. There are two types of hypertension, primary and secondary. Primary hypertension has no clear cause and often occurs with age. Secondary hypertension has specific causes such as kidney or endocrine diseases, certain medications, or pregnancy. Most hypertension is primary and can be prevented by maintaining a healthy lifestyle, avoiding smoking, moderate alcohol use, reducing animal fat intake, eating less salt, consuming more vegetables and fruits, reducing stress, sleeping well, and exercising for at least 30 minutes daily. Thank you for watching the video. If you found it helpful, please like and subscribe so you don't miss the next videos from the channel. If you have any questions or suggestions, feel free to leave a comment below. Wishing you all good health and happiness.